An essential function of the immune system is its capacity to differentiate between normal cells in our body and those it sees as foreign. This allows the immune system to attack the foreign cells while leaving the normal cells alone. To achieve this function, it uses checkpoints. Immune checkpoints are molecules on certain immune cells that need to be activated or inactivated to start an immune response. PD1, programmed cell death protein 1, also referred to as CD279, is one of the checkpoint proteins found on the surface of the immune cells. It is an inhibitor of both adaptive and innate immune responses. In addition, PD1 is highly expressed on tumor-specific T cells. PD1 ligand, PDL1, also referred to as B7H1, belongs to the B7 series. PDL1 is usually expressed by various immune cells and some epithelial cells, particularly under inflammatory conditions to prevent autoimmune responses. In addition, PDL1 is expressed by tumor cells as an adaptive immune mechanism to escape anti-tumor responses. So, if the immune cell approaches the other cells and there was no interaction with the PD1, then it will consider it as foreign and the immune response will be activated to kill these cells. However, if the approached tumor cell had PDL1 on its surface and the immune cell's PD1 interacted with it, suppression of the immune system occurs and the cancer cells will proliferate. This is used by the cancer cells to escape the immune response. Some cancer cells have large amounts of PDL1, which helps them hide from an immune attack. The more PDL1 present on the surface of the cancer cell, the better the response to the PD1-L1 inhibitors will be. Knowing that cancer cells use this pathway to avoid our immune system allowed the scientists to develop monoclonal antibodies that target this pathway. These drugs are called the checkpoint inhibitors. Examples of drugs that target PD1 include pembrolizumab, nivolumab, and cemiplimab. Examples of drugs that target PDL1 include atezolizumab, avelumab, and durvalumab. These drugs have also been shown to be helpful in treating different types of cancer and are being studied for use against others. And it's important to know that checkpoint inhibitors used to treat cancer do not work directly on the tumor at all. They only take the brakes off an immune system so that it can recognize the foreign cells. The concept of blocking PD1 and PDL1 for the treatment of cancer was first published in 2001. Pharmaceutical companies began attempting to develop drugs to block these molecules, and the first clinical trial was launched in 2006, evaluating nivolumab. As of 2017, more than 500 clinical trials involving PD1 and PDL1 inhibitors have been conducted in more than 20,000 patients. By the end of 2017, PD1-PDL1 inhibitors had been approved for the treatment of 9 forms of cancer. The order of application for PD1-PDL1 inhibitors in different cancer types ranging from highest use to lowest use is as follows: lung cancer, liver cancer, melanoma, colorectal cancer, lymphoma, gastric cancer, esophageal cancer, renal cancer, and breast cancer.